EMTs. In this video, I'm going to go over your vital signs for your age groups. That includes adult, children, and infant. So this is the numbers you should be expecting out in the field or in the hospital. So for heart rate, we're going to start with adults. So heart rate for adult is going to be between 60 and 100. This is in BPM, so beats per minute. Anything that is below 60 is going to be considered bradycardic. Not enough room, but basically your heart is not beating fast enough. Anything that is above 100 is going to be considered tachycardic. So tachycardia. It is breathing far too fast, and this is for resting heart rate. For children, it is going to be between 70 and 120, and for infants, infants have a faster heart rate, so they tend to have between 100 and 160 beats per minute. Beats per minute, yes. For blood pressure, for adults, it's going to be between 90 to 120, and the units for this is in millimeter mercury. So anything that is below 90 is going to be considered hypotensive, and anything above 120 is going to be considered hypertensive. For children, there's going to be a special formula, which is 70 plus 2 times the age in years. And this is the minimum threshold. So anything below this number is going to be considered hypotensive, and then the upper limit is going to be 110. Anything above is going to be considered hypertensive. For infants are going to have 70 to 90 millimeter mercury for blood pressure. Moving on to respiratory rate, this is in breaths per minute. So breaths per minute. For adult is going to be standard 12 to 20 breaths per minute. For children is going to be a little faster, so 20 to 30 is a normal range. And for infants they can have a faster breathing rate, so they tend to have between 30 to 60 breaths per minute. Moving on to temperature, this is the internal body temperature for adults. For adults, it's going to be 36.5 to 37.5 degrees Celsius. For children, it is going to be the same, 36.5 to 37.5. And for infants, it usually varies, but the 36.5 to 37.5 is a safe bet. And for oxygen saturation, again, this is going to be in percent, so anything above 95%, anything that is equal or above 95% is normal, and this goes all across the board for children and infants as well, 95%. Now for blood glucose, this is going to be in milligrams per deciliter. That's the unit. For adults, it's going to be between 70 to 120, although some say 80 to 120, but it's generally the same. For children, you're going to have between, again, 80 to 120 or 70 to 120. And for infants, it's also going to be between 80 to 120. And then anything that is below 70 is going to be considered hypoglycemia. So there's not enough sugar in your blood, and anything above 120 is going to be considered hyperglycemia. And then for temperature, I forgot to mention, anything that is below the normal range is going to be considered hypothermia. And then anything above 37.5 or the upper limit is going to be considered hyperthermia. So your body's too hot or your body's too cold. For respiratory rate, also we're going to mention anything above 20 or the upper limit is going to be considered tachypnea. So patients breathing too fast, and anything below the lower limit is going to be considered bradypnea. So they are breathing too slow. And one more thing before I go, for oxygen saturation, anything that is below the 95% is going to be considered hypoxia. It's the proper term. And yeah, so that wraps up for this video. Thank you all for watching. Please subscribe if it helps.